a future history of how affordable nutrition right-sized the healthcare industry. Disclaimer: this is a FutureCast, a fictional exploration of one possible future based on current trends and emerging technologies. While the companies and technologies mentioned are real, the events described are speculative fiction intended to help visualize potential outcomes. Like any forward-looking statement, actual results may vary significantly. This is not investment advice, predictive analysis, or a guarantee of future events. Consider it a thought experiment in what could be possible if current innovations in food, agriculture, and healthcare converge in transformative ways. Introduction. You may remember the first part of this story from a few weeks ago. How Heartland Mart became the epicenter of a revolution that transformed American agriculture, led to the collapse of healthcare costs by 47%, and proved that the shortest distance between soil and health runs straight through a rural grocery store. It all began with an old Dollar General on Highway 41 that was repurposed to offer affordable nutrition and prioritize nutrient density. The story began with Marcus Chen, the store's Nutrition Navigator, a job title that didn't exist when this was still a Dollar General, standing in front of a digital display that shows real-time nutrient density scores for the day's produce, traced back to the exact field where each item was grown. A bushel of sweet corn from the Hendricks farm 12 miles away glows with a golden 97 score. Next to it, imported corn from an industrial operation shows a dismal 31. Today's FutureCast is another important chapter in that story, the one that dives deeper into how Heartland Mart went from soil minerals to metabolic impact, because once customers could see the difference, everything changed. And how this links to the story of the healthspan revolution and health spitals. But first, a disclaimer. This is a FutureCast, a fictional exploration of one possible future based on current trends and emerging technologies. While the companies and technologies mentioned are real, the events described are speculative fiction intended to help visualize potential outcomes. Like any forward-looking statement, actual results may vary significantly. This is not investment advice, predictive analysis, or a guarantee of future events. Consider it a thought experiment in what could be possible if current innovations in food, agriculture, and healthcare converge in transformative ways. Memphis, Tennessee, 2037. Maria Rodriguez stands in the produce aisle of Heartland Mart, her smart cart glowing with a soft green light as she reaches for a bundle of kale. The moment her hand breaks the invisible sensor field around the vegetables, her cart display springs to life.
Based on your current inflammation markers and this morning's glucose pattern, this purple moon kale will reduce your C-reactive protein by approximately 18% within 72 hours. Your sleep quality score should improve by 2.3 points tonight if consumed with dinner.
The display noted. Maria smiles, remembering her first visit here 3 years ago. She'd been skeptical, even scared of all the technology. But Jennifer, one of the store's nutrition navigators, had walked her through everything.
Think of me as your translator. The technology knows the science, but I help you understand what it means for your life.
The grocery store became our pharmacy, our nutritionist, our health coach, and our community center all at once. My doctor still oversees my clinical needs, but now she prescribes foods and lifestyle instead of pills.
Maria Rodriguez, Memphis resident. Around her, the store pulses with purposeful activity. Near the entrance, new customers sit with nutrition navigators for their onboarding sessions, learning to interpret their metabolic data. A grandfather receives real-time coaching on reversing his prediabetes, his plan approved by Dr. Martinez at the Memphis Lifestyle Medicine Clinic. In the community coaching corner, a group of construction workers compare their metabolic improvements on the leaderboard, their employer's wellness physician stopping by weekly to review progress. This is the story of how a digital revolution in grocery stores, powered by personal health data, community incentives, and collaborative healthcare, transformed how America prevents and reverses chronic disease. How physicians evolved from prescribing pills to designing nutrition protocols. How a simple coin system aligned individual health with collective wealth. How human counselors and advanced technology worked in harmony to make the healthy choice the easy choice. How the most advanced medical insights were deployed not in hospitals or clinics, but in the place where health actually begins, the grocery aisle. Chapter 1. The Healthcare Apocalypse That Wasn't. Montrose, Colorado, January 2027. Dr. James Chen stared at the projections on his screen at Montrose Regional Hospital. If current trends continued, healthcare would consume 35% of GDP by 2035. Chronic disease rates were exponential, and with the Medicare and Medicaid cuts that just kept coming, the system was collapsing under its own weight.
We had access to the most advanced medical technology in human history,
Chen later recalled.
MRI machines that could see individual neurons, surgical robots with superhuman precision, artificial intelligence that could diagnose rare diseases. And none of it mattered because we were treating symptoms, not causes.
The Wellness Institute at MIT had just published devastating research. Their analysis of 10 million patient records showed that only 2.8% of chronic disease cases were successfully reversed through medical intervention alone. The other 97.2% remained on medications for life, accumulating side effects and costs.
We were a repair shop that never fixed the root cause. Imagine a mechanic who only treats engine damage but never mentions you're putting sugar in your gas tank.
Dr. James Chen. Meanwhile, in the boardroom, venture capitalist Sarah Kim was meeting with the hospital board. Her firm, Nutrition and Lifestyle First Capital, had a radical proposal. What if they stopped trying to fix healthcare and started right-sizing it?
I showed them data from our pilot programs.
Kim explained.
Grocery stores equipped with metabolic monitoring, personalized nutrition guidance, and lifestyle modification support were achieving 73% reversal rates for type 2 diabetes. No medications, no procedures, just food and behavior change, guided by technology and clinical oversight by Lifestyle Medicine Board certified clinicians, primary care physicians, were repurposed from draining margin to bolstering change.
The board was skeptical until Kim showed them the economics. The average diabetic patient generated $400,000 in lifetime medical costs. The average cost to reverse diabetes through precision nutrition, $12,000, mostly in technology and coaching.
The numbers were so stark that keeping the current system seemed criminally negligent,
Reflected Dr. Margaret Wu, the hospital's CEO.
We were literally profiting from keeping people sick.
By March, Montrose Regional announced a shocking pivot. They would transition from a treatment center to a prevention hub, with their first initiative being a partnership with local grocery stores to prevent the diseases they once treated. The medical establishment erupted. The American Medical Association called it dangerous experimentation. Pharmaceutical companies threatened lawsuits. Insurance companies warned of catastrophe. They were right about one thing: it was catastrophic. For them. Chapter 2. The Quantified Kitchen Revolution. Austin, Texas, March 2028. Jennifer Walsh had worn a continuous glucose monitor for 2 years, tracking her blood sugar responses to every meal. She thought she understood her metabolism. Then she walked into the first NutriSense market, a converted Whole Foods that had become ground zero for the quantified nutrition movement.
Let me introduce you to Sarah first.
Suggested Marcus, the store's lead nutrition navigator.
She'll help you understand what all this technology means for your specific health journey.
Sarah Chen, a certified lifestyle medicine coach, greeted Walsh warmly.
First time with the full system? I know it can feel overwhelming. Think of me as your guide. The technology provides incredible insights, but I'm here to help you understand what matters most for you.
After a 20-minute consultation, where Sarah reviewed Walsh's health goals and explained how her physician, Dr. Joseph from St. Francis Lifestyle Medicine Center, would oversee her nutrition protocol, she handed Walsh the AR preview glasses.
Your doctor, Joseph, has already reviewed your metabolic profile and set your optimization parameters.
Sarah explained.
He'll check in monthly, but I'm here every day if you need help.
The moment Walsh put the glasses on, the store transformed. Every product glowed with a personalized aura. Green meant optimal for her current metabolic state. Yellow meant neutral. Red meant inflammatory. But it wasn't just simple categorization. Each product displayed real-time predictions. A package of wild salmon pulsed with data.
Omega-3 content will improve your morning cognitive function by approximately 15%. Optimal consumption time: 6 p.m. for maximum sleep quality benefit. Pairs well with items in your cart for 34% better nutrient absorption.
We don't sell food anymore. We sell future health states, precisely quantified and personalized.
David Martinez, NutriSense Market CEO. The technology stack was staggering. Her continuous glucose monitor fed data to the store's AI through her phone. Her ultra-human ring powered by Metakarma contributed sleep and recovery metrics. Her Viome gut microbiome test results were integrated. Even her Levels breath acetone monitor, checking fat burning in real time, influenced the recommendations. But the real breakthrough was the prediction engine. Using data from 50 million users, the system could forecast with 89% accuracy how any food combination would affect her energy, mood, inflammation, and even her likelihood of craving junk food later. Walsh picked up a bag of macadamia nuts. Her glasses displayed,
Warning: your current omega-6 to omega-3 ratio is 12:1. These nuts will push it to 15:1, increasing inflammatory markers. Alternative suggestion: walnuts will improve ratio to 8:1.
The store's AI wasn't just reactive, it was proactive. As Walsh approached the dairy section, her glasses highlighted a specific yogurt.
Based on your last 3 days of data, your gut bacteria population suggests you need more Lactobacillus rhamnosus. This yogurt strain shows 92% genomic match to your optimal profile.
It was like having a team of lifestyle medicine board certified clinicians, nutritionists, PCPs, endocrinologists, cardiologists, gastroenterologists, along with data scientists guiding every food choice.
Walsh said.
Except it was better because it was based on my actual body, not population averages.
By the time Walsh checked out, her cart had been optimized not just for nutrition, but for her specific goals: reducing inflammation, improving sleep quality, and stabilizing energy throughout her workday. The receipt showed more than prices. It showed predicted health outcomes.
Total health impact score, plus 47, excellent. Predicted outcomes, inflammation reduction, minus 23%. Sleep quality improvement, plus 19%. Sustained energy increase, plus 34%. Craving reduction, minus 56%.
The cost. Her grocery bill was $147, about 20% higher than her usual shop. But her employer, Dell Technologies, covered the difference through their Food Care Benefits program, knowing that optimized nutrition meant lower healthcare costs, fewer sick days, and higher productivity. Chapter 3. The Birth of Nutrition Currency. Seattle, Washington, September 2029. The idea came from an unlikely source: a Reddit forum for biohackers struggling to afford quality food. User Metabolic Mike posted a frustrated rant.
I know exactly what foods would fix my pre-diabetes. I have all the data. But organic, regenerative food that I can buy from local farmers costs twice as much as the processed crap that's killing me. The system is broken. We need affordable nutrition.
The response that changed everything came from Blockchain Brenda.
What if eating healthy earned you money? What if society paid you to prevent disease instead of waiting to treat it?
Within 72 hours, the thread had 50,000 responses. Developers, economists, nutritionists, and patients collaborated on what would become the NutriCoin protocol, the first decentralized autonomous organization DAO designed to incentivize healthy eating.
We realized the fundamental problem. The costs of poor nutrition are socialized, but the costs of good nutrition are individualized. We needed to flip that.
Brenda Zhang, NutriCoin co-founder. The system was elegantly simple. Every healthy food purchase earned NutriCoins based on its predicted health impact. Coins could be redeemed for discounts on future healthy purchases. Community members could donate coins to those in need. Employers and insurers could contribute to coin pools. The unhealthier the food avoided, the more coins earned. But the genius was in the governance. The DAO operated on transparent smart contracts. When someone chose steel-cut oats over sugary cereal, the system calculated the statistical healthcare costs avoided: 47 cents in future diabetes treatment, 23 cents in cardiovascular care, 18 cents in obesity-related costs, and awarded coins accordingly.
Every purchase became a vote for personal and collective health. The invisible hand of the market finally had a conscience.
Dr. Robert Kim, health economist. Microsoft was the first major employer to integrate NutriCoin into their benefits. Employees who made healthy food choices earned coins that could offset grocery costs, gym memberships, or even be donated to food-insecure colleagues. Within 6 months, Microsoft reported a 31% reduction in healthcare claims. The government took notice. SNAP benefits were reformed to work through the NutriCoin system. Instead of restrictions on what couldn't be bought, the system incentivized what should be bought. A SNAP recipient choosing nutrient-dense vegetables earned bonus coins, effectively stretching their benefits by 40%. Chapter 4. The Community Transformation. Birmingham, Alabama, November 2030. The old Piggly Wiggly on the south side had been a food desert staple: processed foods, sugary drinks, and produce that looked tired before it hit the shelves. When it reopened as a community nutrition hub, the transformation was more than physical,
First thing I noticed was the sound.
recalled Tara Washington, a local teacher.
The store was alive. People talking, laughing, comparing notes. It wasn't shopping. It was a gathering, something we had lost.
The center of the store had been transformed into the community metabolic arena, a space where shoppers could see real-time displays of the neighborhood's collective health improvement. A massive screen showed anonymized, aggregated data.
Birmingham Southside Health Score, 72 out of 100, up 8 points this month. Average inflammation, down 34%. Diabetes reversal rate, 67%. Community NutriCoin pool, 847,000 coins. Available for neighbors in need, 234,000 coins.
We gamified getting healthy, but at the neighborhood level. Your choices didn't just affect you, they lifted everyone.
Deshaun Miller, Community Nutrition Hub Manager. The social dynamics were revolutionary. Shopping parties formed spontaneously, groups of neighbors helping each other optimize their carts. The store's AI would suggest community challenges. If 100 people chose omega-3 rich foods this week, everyone earned bonus coins. The store employed 12 full-time nutrition navigators, each trained in lifestyle medicine coaching. They weren't there to replace doctors, but to bridge the gap between medical advice and daily food choices. Dr. Patricia Williams, who transitioned from traditional practice to become the store's clinical liaison, held office hours 3 days a week.
I still practice medicine,
Dr. Williams explained.
but instead of seeing patients after they're sick, I help them navigate food choices to stay well. I review everyone's nutrition protocols, adjust as needed, and coordinate with their primary care physicians. It's medicine at its most effective. Prevention at the source.
Peer coaches emerged organically. Robert Thompson, a retired mechanic who'd reversed his diabetes, held court near the meat section every Tuesday, showing newcomers how to read their metabolic responses. His informal classes drew dozens of participants, with Dr. Williams often stopping by to add clinical context.
Big Rob saved my life,
said Marcus Green, a bus driver.
Doctors gave me pills and sent me home. Rob taught me to read my body like I read my engine diagnostics. Dr. Williams confirmed my progress every month. Haven't needed medication in 18 months.
The store's Meta Health Corners offered free consultations with AI-powered health coaches and human health coaches depending on need. These weren't medical professionals, but trained community members who could interpret data and suggest food strategies. The AI provided the analysis. Humans provided the encouragement and accountability.
Medical school taught me to prescribe medications. The grocery store taught me to prescribe mushrooms.
Dr. Patricia Williams, who left her practice to become a community health coach. The leaderboards became a source of pride. Families competed for the Most Improved Metabolic Health Award. Churches organized congregational health challenges. The local high school's football team credited their state championship to optimized nutrition, with players shopping together every Sunday. But the most profound change was economic. As the community's health improved, local businesses thrived. Sick days plummeted. Energy levels soared. The virtuous cycle of health creating wealth creating more health transformed one of Alabama's poorest neighborhoods into a model of vitality. Chapter 5. The Science of Nudges. Palo Alto, California, January 2035. Inside the behavior design lab at Stanford, Dr. Lisa Park was obsessing over shopping cart handles. Her team had spent 6 months perfecting the haptic feedback system that would become standard in every smart cart nationwide.
We discovered that gentle vibrations at specific frequencies could influence decision-making without conscious awareness.
Park explained.
A 40 hertz pulse increased likelihood of choosing anti-inflammatory foods by 23%.
The shopping cart had evolved from a simple basket to a sophisticated behavior modification device. The handle monitored galvanic skin response, detecting stress levels. The wheels contained weight sensors that tracked not just what you bought, but your shopping patterns, speed, hesitation, and decision-making rhythms.
Every micro-behavior told us something. Hesitation in the cookie aisle while stressed? The cart would gently steer toward the fruit section.
Dr. Lisa Park. The nudge technology was controversial but effective. Visual nudges. Products optimal for your current health state literally glowed on the shelves. Auditory nudges. Personalized music that subconsciously guided healthier choices. Haptic nudges. Gentle vibrations that rewarded good choices. Social nudges. Notifications when friends made inspiring health improvements. Temporal nudges. Reminders of how you'd feel in 2 hours based on your choice. The most powerful nudge was the Future You visualization. Point your phone at any product, and AR would show 2 versions of yourself. One after a month of eating this food regularly, another after avoiding it. The visualizations were based on real data from millions of users with similar genetics and health markers.
Seeing myself with clearer skin and brighter eyes from choosing wild-caught salmon over farm-raised was more motivating than any nutrition label,
said tech worker Amanda Chen. The carts became so intelligent they could predict cravings before they hit. If your stress levels suggested you were about to binge on ice cream, the cart would proactively suggest frozen berries with coconut cream, displaying exactly how this swap would affect your mood and energy. We weren't controlling choice, we were illuminating consequences. Free will with full information. Dr. B.J. Fogg, Stanford Behavior Design. Critics argued it was manipulation. Supporters countered that the previous system, where food companies spent billions engineering addiction, was the real manipulation. The smart carts simply leveled the playing field. The results spoke for themselves. In stores with full nudge implementation, impulse purchases of inflammatory foods, down 78%. Adherence to personal health goals, up 84%. Shopping satisfaction scores, up 91%. Average health improvement, 4.2 times faster than control stores. Chapter 6. The Healthcare Evolution. Tulsa, Oklahoma, March 2035. The St. Francis's quarterly board meeting was surprisingly optimistic. While traditional patient volumes had dropped 64% in 3 years, their new lifestyle medicine partnership program was thriving.
We didn't lose our purpose,
explained CEO Dr. Richard Stevens. We evolved it. Instead of treating chronic disease, we can reverse it and now even provide clinical oversight for prevention at scale. The transformation created a new healthcare model. Physicians designed and monitored personalized nutrition protocols. Lifestyle medicine specialists held regular hours at Heartland Marts. Nurses became certified nutrition navigators. Pharmacists transitioned to pharmacists, experts in food-drug interactions. Specialists focused on optimizing treatments rather than managing disease. We went from being siloed with grocery stores to partnering with them. The results speak for themselves. Dr. Richard Stevens. The new structure included 200 physicians providing remote oversight for 2 million nutrition protocols, 500 lifestyle medicine counselors embedded in local stores and via wearable devices, monthly check-ins replacing quarterly sick visits, prevention bonuses replacing procedure fees, collaborative care teams including doctors, nutritionists, and community coaches. The numbers told the story. Type 2. Diabetes diagnoses. Down 79%. Medication needs, reduced 67%, with physician supervision of tapering. Patient satisfaction, up 91%. Physician burnout, down 73%. Healthcare costs, decreased 52%.
I see 100 patients a day now, but they're all getting healthier,
said Dr. James Chen, who added lifestyle medicine board certification to endocrinology.
I review their lifestyle, including food choices, adjust protocols, support change, and celebrate victories. It's why I became a doctor.
Insurance companies evolved their models too. United Health's collaborative care program covered physician protocol design and oversight, $50 per month per patient. Weekly nutrition navigator sessions, fully covered. Continuous monitoring and adjustments included. Traditional sick care when needed, still available.
We were able to reimagine health insurance benefits to support health once nutrient density and affordable nutrition became the standard and personalized nutrition was part of everyday life.
Jennifer Walsh, United Health CEO. Medical schools scrambled to adapt. The traditional curriculum of diagnosis and prescription became obsolete. It was through the early leaders such as Alice Walton with her new medical school in 2025 that started the shift. New programs focused on metabolic optimization, nutritional genomics, behavioral transformation, community health design, food system architecture. Young doctors no longer dreamed of specialty practices. They aspired to become chief nutrition officers at grocery chains or for CPGs, where they could prevent and reverse disease at scale rather than treat it individually. Chapter 7. The Algorithm of Life. San Francisco, California, June 2035. The breakthrough came at 2:47 a.m. in a small apartment above a Korean grocery. Yuki Tanaka, a former Google engineer, had been working on the problem for 3 years. How to create an AI that could predict optimal nutrition not just for health, but for specific life performance.
Everyone was focused on preventing disease,
Tanaka explained.
I wanted to optimize life itself. What foods would make a pianist play better? Help a programmer code more creatively? Enable a parent to be more patient?
Her creation, the Life Optimization Algorithm LOA, analyzed millions of data points. Genetic markers, microbiome composition, sleep patterns, stress responses, cognitive performance metrics, emotional regulation patterns, creative output measurements, social interaction quality. Food wasn't just fuel or medicine. It was a programming language for human performance. Yuki Tanaka. The algorithm discovered stunning correlations. Specific mushroom compounds improved musical creativity by 34%. Fermented foods enhanced emotional resilience in social situations. Particular amino acid combinations boosted coding efficiency. Timed carbohydrate intake optimized parental patience. Within months, LOA was integrated into every major grocery platform. Shoppers didn't just scan for health, they scanned for life goals. Preparing for job interview generated a meal plan to optimize confidence and clarity. Training for marathon created nutrition protocols for endurance and recovery. Studying for exams suggested foods for memory consolidation and focus. Trying to conceive provided fertility-optimizing nutrition plans. The personalization went beyond individual optimization. LOA learned relationship dynamics. Couples could shop for relationship harmony, receiving food suggestions that balanced both partners' neurotransmitters for better communication.
My marriage was saved by Brussels sprouts,
laughed software engineer David Kim.
Turns out when we both ate cruciferous vegetables, our arguments decreased by 70%. The sulfur compounds helped us both process stress without taking it out on each other.
Chapter 8. The Shelf-Stable Revolution. Kansas City, Missouri, August 2035. Everyone assumed the nutrition revolution would bypass packaged foods. Big food would resist, processed products would remain toxic, and the movement would stay limited to fresh produce. Everyone was wrong. The transformation began at Thrive Naturals, a startup that asked a simple question: what if shelf-stable could be more nutritious than fresh?
Fresh produce loses nutrients every hour after harvest,
explained CEO Dr. Priya Patel.
We realized that properly processed foods could lock in peak nutrition indefinitely.
Their breakthrough was the Nutri-Lock process: harvest at peak nutrient density, flash process within 2 hours, preserve using natural fermentation, package with nitrogen flush. Result: 94% nutrient retention for 2+ years.
A 2-year-old jar of our fermented vegetables had more bioavailable nutrients than fresh vegetables from most grocery stores.
Dr. Priya Patel. Big food companies, seeing their market share evaporate, pivoted hard. General Mills acquired 6 regenerative farming operations and launched Ancient Future, a line of shelf-stable products that scored 85+ on nutrient density scales. Kraft Heinz shocked the industry by open-sourcing their reformulation research. Their Project Phoenix showed how to transform any processed food into a functional medicine. Mac and cheese with added prebiotics and resistant starch. Ketchup fermented with beneficial bacteria. Crackers made from sprouted ancient grains. Cookies that improved gut health. The transformation reached frozen foods. Advanced freezing techniques preserved not just nutrients but beneficial enzymes and probiotics. A frozen pizza could now be more nutritious than most restaurant meals.
We kept the convenience America loved but added the nutrition America needed.
Roberto Silva, Kraft Heinz, Chief Innovation Officer. Chapter 9. The Super App Revolution. Los Angeles, California, October 2035. Sarah Chen's phone buzzed softly. Based on your cortisol spike 20 minutes ago and upcoming deadline, stop by Heartland Mart in the next hour for your personalized stress response nutrition protocol. The Nutri-Life Super App had become the control center for 100 million Americans' health. Modeled after WeChat, but focused entirely on metabolic optimization, it integrated real-time biometric monitoring, grocery shopping and meal planning, cooking classes and community meals, restaurant ordering with metabolic matching, social features and community challenges, health coaching and peer support, financial rewards and NutriCoin management, predictive health alerts, life performance optimization. It wasn't just an app, it was your metabolic co-pilot, nutritionist, coach, and accountability partner in your pocket. Sarah Chen, early adopter. The app's intelligence was breathtaking. It learned your patterns, preferences, and responses. It knew that you craved sugar when stressed, so it preemptively suggested alternatives. It recognized that your sleep suffered after late-night cheese, so it reminded you at 7 p.m. But the killer feature was metabolic matching for restaurants. Open the app near any restaurant, and it would instantly analyze the menu, showing exactly which dishes would optimize your current state. Restaurants competed to offer the most metabolically friendly options. Date night became optimization night. Couples would compete to find restaurants where they could both eat perfectly for their biology. Marcus Thompson, restaurant critic. The social features transformed health from a solitary to a community journey. The metabolic tribes feature connected people with similar health goals and genetic profiles. Late-night craving support groups formed spontaneously. Victory celebrations when someone reversed a condition went viral. The app even integrated with dating platforms. Metabolic compatibility became a key matching criterion. Couples with aligned nutrition needs reported 40% higher relationship satisfaction. Chapter 10. The New Economics of Nutrition. New York City, November 2035. The New York Stock Exchange had seen many historic moments, but nothing quite like this. NutriDAO was about to become the first trillion-dollar organization with no CEO, no headquarters, and no traditional structure.
We're witnessing the birth of a new economic model,
announced Bloomberg analyst Maria Rodriguez.
Value creation through value prevention, profits from optimization, not exploitation.
The economics were staggering. Healthcare costs down $1.4 trillion annually. Productivity gains up $800 billion annually. Reduced sick days, saving $400 billion annually. Increased health span, adding $2 trillion in economic value. Total economic impact, $4.6 trillion per year.
The sick care industrial complex fought hard, but math doesn't lie. Healthy people create more value than sick ones. Healthcare was right-sized.
Dr. James Morrison, economist. The transformation reached unexpected sectors. Real estate, properties near community nutrition hubs commanded 45% premiums. Developers built metabolic communities with integrated food systems. Education. Schools with optimized nutrition programs saw test scores rise 38%. Harvard launched the first Nutritional Excellence Admission Track. Criminal justice. Prisons implementing precision nutrition saw violence drop 67% and recidivism fall 54%. Finance. Health bonds, backed by community nutrition improvements, became the hottest investment. Cities issued bonds to fund grocery store conversions, paid back through reduced healthcare costs. The gig economy transformed. Metabolic coaches earned more than software engineers. Nutrition navigators became the fastest-growing profession. Community health architects designed food systems for optimal population health. Traditional power structures crumbled. Pharmaceutical companies either pivoted to nutrition or disappeared. Insurance companies became health investment firms. Hospitals became optimization centers.
We didn't reform healthcare. We made it irrelevant for 80% of what killed people.
Sarah Kim, Nutrition First Capital. Chapter 11. The Global Awakening. Geneva, Switzerland, January 2036. The World Health Organization's emergency session had been called to address a crisis, but a positive one. Global chronic disease rates were plummeting so fast that entire economies built on sick care were collapsing.
We face a crisis of success,
admitted World Health Organization Director General Dr. Chen Wei.
Health is spreading faster than our systems can adapt.
The American model was being replicated worldwide. India's Bharat Nutrition connected 800 million people to optimized food systems with physician oversight. China's Health Harmony program integrated traditional Chinese medicine practitioners with metabolic tracking. Brazil's Favela Fresh brought community nutrition hubs with local doctors to every neighborhood. Nigeria's Africa Eats platform connected traditional healers with modern nutrition science.
Every culture had wisdom about food and health. We just gave them tools to prove and scale that wisdom while keeping their healers central to the process.
Dr. Adaora Okonkwo, Africa Health Initiative. The global impact was transformative. Diabetes prevalence from 10.5% to 2.1% worldwide. Mental health conditions down 64% globally. Cardiovascular disease reduced by 71%. Healthcare spending from 10% to 4% of global GDP shifted from treatment to prevention. Life expectancy increased by 11 years average. Physician satisfaction up 82% globally as roles shifted to prevention. But the real revolution was in human potential. With optimized nutrition, humanity experienced a cognitive renaissance. Average IQ increased 12 points. Creative output doubled. Workplace productivity rose 45%. Social cohesion improved dramatically. Violence decreased 58% globally.
We discovered that most of human suffering and limitation was simply malnutrition disguised as normalcy.
Dr. Chen Wei. Chapter 12. The Store as Cathedral. Nashville, Tennessee, December 2036. I'm standing in the Heartland Mart where it all began, but it's unrecognizable from its Dollar General days. The space has become something between a grocery store, a community center, a health clinic, and a temple to human optimization. It sits across the street from the Health Spital Collective, where the community gathers daily for meals and movement. Between Heartland Mart and the Health Spital, all aspects of personal health span are frictionless. It's about thriving, not surviving. The morning metabolic mass is beginning, a daily ritual where community members gather to share victories, seek support, and plan their health journeys. Elder Thompson, who reversed his diabetes 4 years ago, leads the gathering.
We gather not to worship, but to witness,
he intones.
To witness the miracle of transformation that happens when we align our choices with our biology.
The store pulses with purpose. In the optimization chambers, individuals receive real-time biofeedback while selecting foods. The community kitchen hosts classes where grandmothers teach teenagers to ferment vegetables while teenagers teach grandmothers to read their metabolic data.
This isn't shopping, it's communion. With our food, our community, our optimal selves.
Elder Thompson, the Children's Metabolic Garden, inspired by Big Green and the Green Bronx Machine back in 2025, showcases the next generation. Kids as young as 5 understand their genetic variants, microbiome composition, and optimal nutrition strategies. They grow food, test its nutrient density, and track how it affects their performance in school.
My daughter talks about her mitochondria like previous generations talked about their toys.
Laughs parent Jennifer Martinez.
She optimizes her breakfast for her spelling test. It's a different world.
The Wisdom Wall displays thousands of testimonials. 62 pounds lost, diabetes reversed, life reclaimed. Off antidepressants after 20 years. Autoimmune condition in complete remission. Running marathons at 70. Clear skin, clear mind, clear purpose. But beyond individual transformations, the store has become the beating heart of community resilience. During the recent economic downturn, the community's NutriCoin reserves ensured no one went without optimal nutrition. Crime virtually disappeared. Teen pregnancy dropped 80%. College acceptance rates tripled.
We proved that a grocery store could be the foundation of civilization.
Susan Whitfield, Heartland Mart founder. Epilogue, The Choice Point. Memphis, Tennessee, January 2037. Maria Rodriguez finishes her shopping, her cart perfectly optimized for her upcoming week. The receipt shows not prices and products, but promises and probabilities. This week's nutrition will likely result in energy levels, sustained high throughout workday. Sleep quality, 8.2 hours average, 23% deep sleep. Mood stability, 91% positive outlook probability. Inflammation, continuing downward trend. Health span. Impact. Plus 3.2 days added to health span. She pauses at the exit, remembering her grandmother who died at 58 from complications of diabetes, her mother who struggled with depression, her brother who battled obesity. All preventable, all tragic, all ancient history now.
We had a choice.
Maria reflects.
Continue accepting that sickness was normal or demand that health was possible. The technology just made the choice visible.
The transformation wasn't without challenges. Old systems resisted. Some physicians felt threatened before realizing they could practice prevention instead of just treatment. But the partnership model, where doctors provided oversight while stores provided daily support, proved irresistible. Results spoke louder than skepticism.
We didn't need to eliminate healthcare. We needed to redirect it upstream.
Maria Rodriguez. As Maria loads her groceries, her daughter asks,
Mom, why do we still go to Dr. Chen if we don't get sick anymore?
Maria smiles.
Dr. Chen helps design our nutrition plan, honey. She makes sure what we eat keeps us healthy. It's like having a coach instead of waiting for a repair person.
Her daughter nods.
So doctors keep us healthy instead of fixing us when we break.
Exactly, baby. And the nice people at the store, like Miss Jennifer, help us follow the plan every day.
The future hadn't eliminated healthcare. It had transformed it. Doctors still mattered, perhaps more than ever. But their role had evolved from treating disease to optimizing human potential. The vast majority of chronic conditions that had plagued humanity were prevented at their source. The intersection of food choice and human biology. The grocery store had become our daily pharmacy. The nutrition navigators had become our health coaches. Our doctors had become our wellness architects. And food, real food, guided by both human wisdom and technological precision, had become our primary medicine. The revolution wasn't led by doctors or politicians or tech billionaires. It was led by ordinary people making extraordinary choices, one shopping trip at a time. They proved that the shortest distance between a sick society and a healthy one runs right through the produce aisle. Welcome to 2037. The aisles are smart. The food is affordable nutrition. The community has come together and ended the chronic disease epidemic. And it all started with a simple question. What if we made the healthy choice the easy choice? The answer changed everything.